Hello, welcome to the Nursing Moms. It's me, Nurse Janet. And have you ever been a victim of this embarrassing situation where you just want to scratch your private parts? Okay, it's a very common thing amongst women, and you should not feel embarrassed. In this video today, I'm going to talk about the possible causes of vaginal candidiasis, the management, treatment, and prevention of vaginal candidiasis. Watch to the end. Welcome to the Nursing Moms. If you like our videos, hit the like button and subscribe. Stay updated for more coming videos by hitting the notification bell. The vaginal candidiasis, it's also known as the vulvovaginal candidiasis, is a yeast infection that affects the vaginal tissues at the opening of the vagina. Actually, there are several things that can lead to this. The causative organism of this infection is called a fungus known as the Candida albicans. Let's look at signs and symptoms of vaginal candidiasis. Number one sign is itching. This is a noticeable one and you cannot avoid, you just want to scratch yourself. The second thing is that you realize you're having a burning sensation while passing urine due to the scratches that you've made down there. Remember, the skin down there is a bit sensitive, and so scratching it can lead to some lacerations and bruises. So if you'll be going to pass urine, you realize you'll be feeling some burning sensation down there. Again, it has a typical type of discharge, that is the thick, white, curdle-like milk discharge. Another thing you realize is the redness of the labias. They'll be inflamed and red. There'll be so much discomfort while having sexual intercourse. A healthy vagina houses some bacteria and fungi for their protective function. Actually, this bacteria and fungi just thrive as a normal flora in the vagina by just maintaining the pH of the vagina by being slightly acidic. That is from 3.8 to about 4.5. There's so many things that can lead to this bacteria and fungi having an overgrowth and causing infection. What causes vaginal candidiasis and why is it so recurrent? The recurrent nature of vaginal candidiasis can tell you that the cause can be something that we do use in our day-to-day activities of life. It can be the scented sanitary towel. It can be the medicated soaps that we are using. It can be the colored tissues. It can be the fabric softeners that we are using, and you are not rinsing or thoroughly washing your undergarment to rinse off the detergent fully. All of these can lead to alteration in our normal vaginal pH, leading to some dryness and an overgrowth of the yeast causing an infection. The other things that will lead to vaginal candidiasis is when you have a weak immunity. Actually, if you are immunocompromised, like you are having a HIV infection, you are at a risk of getting the oral thrush or vaginal thrush, that is the vaginal yeast infection. Another thing is prolonged use of antibiotics. Remember, an antibiotic doesn't have a specific target in your body. You can be taking an antibiotic for respiratory tract infection or even for the urinary tract infection, but there's no specific target in the body, so it's an antibiotic. It will end up killing the healthy bacteria in your vagina. This will lead to fungus overgrowth. One thing you'll note that during pregnancy, the vaginal candidiasis can be so common. This is due to the pregnancy hormone, that is the estrogen, can overthrow the normal balance of the bacteria and fungal in your body, leading to fungus overgrowth, hence leading to recurrent vaginal candidiasis. If you are a diabetic patient, you are also at risk of getting vaginal fungal infection. Remember, the fungus thrives or feeds on the sugar. So if you have uncontrolled sugar levels in your blood, you are at risk of feeding the fungus, leading to their overgrowth, hence leading to vaginal candidiasis. Other things that can predispose you to getting vaginal yeast infection includes douching, vaginal steaming, and hot baths. All these can kill the normal bacteria in your vagina, leading to the fungal overgrowth. Hormonal imbalances and use of oral contraceptive tool can put you at risk of getting vaginal yeast infections. At times, vaginal candidiasis can be so mild and subsides on its own. But again, if the symptoms are so persistent or so severe that you cannot tolerate, then you need to see a doctor. How are we going to treat vaginal candidiasis? Vaginal candidiasis also needs treatment, and the treatments include use of antifungal pessaries, the oral antifungal drugs, and even use of topical antifungals. You will get this over the counter, or you can get them at the hospital after consulting your doctor. Probiotics such as yogurt, and there's some probiotics that you can be given in the hospital, has also been so helpful in the management of antifungal infections. Actually, there's some natural yogurt that you can use even to apply on the affected areas. On the prevention of vaginal candidiasis, we have to try as much as we can to avoid things like douching. Actually, douching can kill the healthy bacteria that always controls the growth of fungus, leading to an overgrowth of fungus. Hence, we have the vaginal yeast infection. Another thing is to avoid use of deodorants on our private parts. Avoid using strong scented medicated soap even on your undergarments. If at all you have to use them, then rinse thoroughly to ensure that you have rinsed all the detergent on your pant. Try as much as you can to sun dry your panties. Yeah, it's healthy to sun dry them. Another thing we have to try as much as we can is to remain dry. Yeah. Being wet for so long can also lead, fungus thrives most in a wet place. So you have to either use panty liners, cotton panties that can absorb the moisture that you are getting. Bathrobes and wet towels should be changed more often and at least have them sun-dried together with your panties. Improve on your diet to help you boost and build your immunity, because low immunity actually invites a lot of infections, including the fungal infection. Vaginal candidiasis is not a sexually transmitted infection, so you don't have to worry like, oh, I've been so good to myself, clean, faithful, and here you are scratching your private part. No, it's not a sexually transmitted. It's just a fungal infection, something that lives within us in a normal flora temperature. But again, if we interfere with it, then it harms us.